Hello, everybody. I'm Dr. Chip Whitney from Revolutionary Health Services. And I'd like to welcome to you all who are watching us today. And I'm very excited now that on this date of May 7th, 2020, who'd have thought the May would be bringing what it is right now, 2 months ago. But I have with me today our State Rep Wendi Thomas, who's going to talk to us about what's happening in the real world of COVID-19. So Wendi, welcome. So
Thank you.
thanks for
Thank you very
joining
much for
us.
having me.
This is great. So one of the things I wanted to point out is that in the last couple of weeks, I've started doing a lot of antibody testing on my patients, and many of whom had some symptoms in February and March and early April that they thought might have been COVID-19, but weren't sure. And interestingly, that I found literally, except for the Whitney family and a couple boyfriends, that we've been antibody negative. Every single person came back that they weren't
Wow.
actually exposed. Those symptoms that they had were not COVID-19. But there's a lot, it reminds us all that there's a lot of viruses out there that aren't COVID-19. So, and I've actually been very impressed with two of them. One was an emergency room doctor who's obviously swimming in this
Wow.
now, that person was antibody negative, so their infection control was good. And I actually had another patient who was admitted to Capitol Health for a week, and she came back antibody negative. So infection control has been very good. So now we're starting to hear about opening up our state. And I've read about Governor Wolf's green, yellow, and red plan. And I'd
Yep.
like it if you could just help explain to everybody what that is in Pennsylvania, what we can expect for reopening, and how that might differ a little. I'm hearing on a national guidelines and recommendation strategy. I know they're leaving it to the states to make the final decisions because they know best. But there was like it sounds like our yellow plan was a two-step process nationally. Could you just explain for everybody about that?
Sure. Here in Bucks County, we're in the red zone, and actually until tomorrow, Friday, the whole state's in a red zone, which is pretty much stay at home, except for urgent travel, don't go out. That's pretty much urgent travel being exercise, groceries, things of that nature. So that's the red. The yellow is a modified opening. It is go back to work, but telecommute if you still can. Bars and restaurants still do carry out and delivery. Large gatherings are 25 or less are the only thing that's allowed, and social distancing should still take place. But childcare can go back to opening. Schools aren't going to open this year. Hopefully they will next year, but it starts to get us back on track. And what the governor said, he's going to look at county by county and region by region. He has divided the state into regions, but he has also said he'll look at counties and they'll move to the yellow. And then from the yellow, they can move to green. And green is more what we're used to, but maybe with still some social distancing, spreading out, a little modifications, but for more or less, green is, schools go back in session, etc.
Our new normal. I mean, we don't
Our
really
new
know what
normal.
that's going to
Yes, our
be.
new normal.
So interesting. So we're not going to have schools in the yellow, and childcare. That's encouraging for people going back to work. They'll have the
Yep.
childcare bill. I'm sure people are going to love hearing that. I guess, and as I'm thinking about it, it's like, is there any talk about do you know the criteria for going from yellow to green? I know we're not there yet, and it may kind of evolve with time, but it's just, I'm thinking about, I'd love to be able to go out to a restaurant and stay 6 feet away from the person next to me and be able to have a nice dinner with my wife. Is there any, but that's not till we're in green. And I'm like, do we know at all about when we might be able to, I actually have to say, I'm thrilled to hear it's the rural counties that he's doing it by county, because it's, that makes total sense. I mean, we shouldn't open up before central Pennsylvania where they've had no cases, but green, do we have any feel for the green plan?
We actually don't, hasn't been defined. There's been so much focus since we're all in red about red to yellow that the yellow to green conversation hasn't really happened yet. The governor opened 24 counties. They all had very, very few cases ever. We actually have one county that had one case.
Wow.
I'm sure those people who live in that county were very frustrated because everything's been shut down and they had one case in their whole county. But that being said, he did 24, and there's some slight signs from him that he might announce some more counties, maybe today. I don't think, sadly, though, it will be Bucks County at this time. We are still trending higher than.
Got it. So we don't know when the we're going to go over to green, and that's okay. There's a lot of things we don't know these days, so that's perfectly fine, not knowing that. So, well, I'm going to segue a little bit over into what is happening right now. So last week I spoke to several local leaders in hospitals, an ICU doc at Doylestown, a hospitalist, an administrator, and it seems like our number of cases is diminishing, which is great to hear. And I'm not surprised that the hospitals are still pretty full, fairly high. It's not having a bad surge, but they're still they haven't gotten on the downside of the surge yet. And the deaths are unfortunately increasing still. But what I'm hearing and understanding is that it's the nursing homes, long-term care facilities are where the big problems are. So, and I know that up in New York, they've been having some struggles where that a huge number of the deaths in New York City are from the nursing homes, and they were really wishing that they had taken, instead of people going from the hospital or the emergency room straight back to the nursing home, that they had a place to recover where they weren't going to make the rest of the nursing home get infected. Up there they had the big ship that was there, and they had the Javits Center. We don't have something like that in Pennsylvania. Is there any discussion on what we can do to help protect the nursing homes?
So this has probably been one of the biggest issues this week, and particularly here in Bucks County. 75% of our deaths, according to Dr. Damsker, who is our director of our county health. And just for your listeners, only 7 counties in Pennsylvania have a health department. So we are very fortunate in Bucks County. We not only have a health department, we have an amazing director in Dr. Damsker, because he happens to be an infectious disease specialist. So 75% has originated in our long-term care. I believe the number I was told yesterday is 66 long-term care facilities in Bucks County have had either staff or residents or both with COVID. So I think the opportunity to a center set up down in the city, but to isolate the people who had it and not return them to long care, I think we're kind of past that. I think at this point, what we have to look at is there are hotspots, and we need to support them. They still need PPE. We've actually called the ones in my district, asked them, what can we do for you? How can we help you? So we're going to be doing a drive to collect PPE. They want activity books because residents are in such isolation, and it's hurting their mental health. And then we're asking if the public wants to make handmade cards. The kids can make cards, or people want to make cards for the staff, for the residents. So we're going to do a small collection next week because those long-term care centers are really hurting. And the county commissioners asked the governor, and I signed on to a letter with some other legislators asking the governor, could you take a look and count the residents of long-term care, but look at them separately from the general population? Because what we're seeing there is significantly different than what we're seeing in the general population. To your point of people didn't have the antibodies that you tested who thought they might have, but yet in the long-term care setting, we are finding a lot of people as we test the whole population that have been exposed to COVID.
Yeah, the vulnerable are vulnerable to get it, in addition to having a bad outcome when they actually get it. So I agree with you. The statistics that as we're learning more and we can make more of our decisions based on real science and not just speculation, it really does seem that our maybe not the sole focus, but 2 things need to happen. We need to get people back to work because people are hurting financially with that. We need to get we need to let people mental health. I mean, I'm really, as a physician, worried about the whole depression, the isolation. Humans are pack species. I mean, we are mammals also, and we're a pack. We need community. We need personal interaction. And especially with the vulnerable, I love what you're saying about helping out the folks in the nursing home. We can't go in there and give them a hug or or say hi to them personally, but we can do things for them to make them feel needed.
Yeah.
Because people who are the old couple staying at home because they have to, the nursing homes, whatever, those are the ones we really would, I guess, open our effort. And it does seem like it really is in the younger, healthier crowd, it really isn't all that bad, so that we can begin to open up. And actually, it's not for this discussion, but it actually may help to protect us months down the line if we start to get out there. And then we're now moving, get out in the sunshine. I do encourage people. I'm thrilled that they opened up the golf courses and the parks so that people can get out there and do things.
I think the people in the long-term care facilities, to your point too, they know it's had a really negative effect on there. And while the general community is hopeful to move to yellow, they're not looking at a time when people can come in their facility in the near future. And it's a great struggle. And the staff is struggling. We've had some staffing issues now. The county's helped and the state's looking to help, but once we get to a place where we feel like we should absolutely take a look back and say, what could we have done better, for that population that is in a confined space, and how could we help them? And I sit on aging, and I hope that our committee, will take up that project.
Yeah.
But as we sit here today, I think we divide that, and we have a plan for long-term care, and we have a plan for the general population. We don't ignore anybody. It's been devastating to everyone. But I think it makes more sense to have separate initiatives and separate help for those two different populations.
Yeah, I'm glad to hear we're learning from all of this, because we baby boomers, we hope to live a long time, but this is not going to be the last epidemic or pandemic in our lifetime. Yeah. There's something's going to happen down the line, and knowing what to do from the beginning and to protect the vulnerable. I mean, there's going to be a lot of lessons learned here, and I am glad to hear that they're doing a lot of research, so fast research for this. So, I mean, is there anything else that we should know that's happening? I mean, certainly the unemployment issue is a massive one. Is there anything that you can comment about that, or anything else that your constituents have been asking you that our listeners should know about?
I almost want to say, speaking of mental health, the biggest mental health stressor, we hear about, there's general reopening we're hearing certainly from people, but we literally have over 100 cases open to help people in the unemployment area. The state has really, really struggled to keep up, and lots of changes. But breaking news as of this morning, and I know your listeners are probably listening to it on Thursday, May 7th in the afternoon, so hopefully they know already, but if they don't, the self-employed unemployment, which is an unusual system that the feds put out and told the states to administer. Usually if you're self-employed, you're not eligible for unemployment. They offered a system and financed it, and it was open. You could register, but you couldn't put in your weekly claims. And this morning, as of 6 a.m., they fully opened it up. So we are getting that word out to everyone who's contacted our office. If you are still struggling with unemployment and you are listening to this, call your state rep. If I'm your state rep, please call my office. Let us know what your struggles are. We have begun to be able to help people move forward. But, some of these people are now 2 months without any income. And no, it's a huge struggle.
It is. I know a person who owns a delivery service, and they're not delivering anything these days, and he's hurting big time, and he doesn't have any employees. So he wasn't eligible for the PPP protection, and he's self-employed and couldn't get unemployment. So he's hurting a lot, and there's a lot of people out there. That's really exciting. So wow, we have breaking news. Yes. So it's that's great. So well, good. So we need to do this again, because I mean, current events change daily. I mean, it's May 7th now, and May 14th is going to bring a whole lot of new issues at hand. So, but good. Well, I really appreciate you being with me today here, Wendi, and I encourage anybody listening to share this with your friends, because we got a lot of good information today. And it's just we're all struggling, and we all need good resources for learning. So again, this is Dr. Chip Whitney with Revolutionary Health Services, and take care of yourself, take care of your families, and like we said today, reach out to the vulnerable, because they're isolated, and we have a little bit of hope in our lives, but they're not going to be opening up anytime soon, and they are really hurting, and we need to be there for them. All right, everybody, have a great day.
Thank you.
Thanks, Wendy.
Thank you.